Ladies and gentlemen, when you start seeing these stories on rural America more frequently, you know they're in serious trouble. They are in serious, serious financial trouble. And these folks are primarily elderly because much of the young people, they are gone. And the few that are left, unfortunately, many of them are struggling with opioids. Many years ago, they were passing down a lot of the farming to the young. And now, because of opioids, many of these farmers, their children, sometimes all of their children, have a drug problem. And they really don't have anybody to pass those farms on to anymore, not like they used 2 years ago. And many of the young people don't want anything to do with farming, they don't want to do it back-breaking work every day, and then you gotta hire migrants or immigrants to come in and be out in the baking hot sun to harvest your crop and take care of it. You know, they don't want anything to do with that, not anymore. Many of the younger generations, they are walking away from farming. And you have a few people coming back and embracing it, but it's still not enough to make a huge impact. And you also got to factor in a lot of these rural communities were heavily impacted by this past winter and the heavy snow and the heavy rain. And you see the flooding going on all across middle America. A lot of flooding, and some of the people are still sitting there, but they can't save their farmlands. And I did a story last week on how many of them are saying that they're finished for 2019 as far as farming is concerned. It's a complete loss because of the bad conditions and the heavy rain and the flooding. They couldn't even get their crops in the ground. Many have lost livestock in the floods. The snow, I did a story on cows being buried in the snow, and the majority of those cows died. They didn't survive. They were trying to dig them out, but they couldn't get them all out. So the majority of them died. So it's been a tough time for these areas. And unfortunately, it's going to get tougher because they just don't have the kind of money to support those communities like they used to. They're not pouring a lot of money in these areas. They may have at one point in time, but not anymore. So we're going to go ahead and listen to the audio from NPR.
The economy may be strong, but many Americans' finances are not. That's especially true in many rural areas. In a poll of rural Americans by NPR last fall, 55% of those surveyed said their local economy was only poor or fair. Follow up poll by NPR, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health digs deeper. It finds 4 out of 10 rural Americans struggle with routine bills for housing, food, and medical care. Half of rural Americans say they could not afford it if they got hit with a surprise $1,000 expense. NPR's Patty Namath has more.
Our new poll was a telephone survey of just over 1,400 adults living in rural areas across the country. Areas like Whitesburg, nestled in the mountains of eastern Kentucky coal fields. 72-year-old Letha Dollarhide, a retired caregiver, lives nearby.
Go out of town like you're going toward Hazard, and there's a turnoff there on 931 South. It's within about 4 miles of where I was born, so...
I asked Dollarhide the question we asked in our poll. Could you afford an unexpected $1,000 bill?
No, there's no way.
Not even a $200 extra bill. What about savings?
My savings account is zero. I don't even have a savings account.
Dollarhide worked all her life, but the jobs just didn't pay enough for her to put anything aside. She raised 4 children. Today, her income, Social Security and supplemental security income, adds up to $790 a month.
With that income, you watch every penny.
Even so, Dollarhide just couldn't afford to make it on her own. She recently moved into a 2-bedroom trailer with her daughter. Even with the extra money from her daughter, it's still hard. They have no car, and the cost of electricity is barely affordable.
It was 360 something, and the $200 rent, there's nothing left.
So, no movies, no dinners out. The only luxury is cable TV. But Dollarhide says she's one of the lucky ones. She has Medicare and a state health plan that covers her health costs. That's not the case for many of those in our poll. Harvard professor Robert Blendon.
1 in 4 reported that they could not get health care recently when they needed it. And the majority said it's either because they couldn't afford it or they had insurance that would not be taken by local health providers.
A serious national concern, says Blendon, even with major improvements in health insurance coverage over the last decade.
These problems are more severe for African American communities and Native Americans,
as well as Latinos. And the future of healthcare in rural America looks even more grim, says Brock Slayback with the National Rural Health Association. 106 rural hospitals have closed over the past decade, which he says can make timely medical care nearly impossible. Take the town of Tonopah in Nevada. Its hospital closed a few years ago.
This left the ambulance service to deal with all kinds of medical problems that they're not situated to do. And so when they get on the road to the next nearest hospital, that's a 3-hour trip one way.
The hospital is more than 100 miles away.
We know that distance can be a barrier to timely and appropriate access to services. And so, in that context, delayed care can often lead to tragic consequences.
Especially in rural areas where people may not have a car and public transportation may be unreliable. Bottom line, says Slayback, wealth equals health.
We're poor and we're sicker.
Dee Davis is president of the Center for Rural Strategies in Whitesburg.
People in this congressional district have the shortest lifespan in the United States. We also are the poorest.
But one of our big findings was that rural Americans are also optimistic about their communities. Dee Davis.
People may be living more of a hardscrabble existence than folks in the suburbs or a lot of the folks in the cities, but it doesn't mean they're not living a decent life. And most people are pretty happy with it, and they've got friends and neighbors that they rely on, and they're where they want to be.
Community activist Nell Fields says over the past few weeks, when her husband was hospitalized, her neighbors were extraordinary.
My neighbors come and mow my grass, and my neighbors come and feed our cattle, and our neighbors get the eggs and every day for the last few weeks. And that says so much to me, makes me feel the emotion now of what it feels like to have such warm, wonderful support. And I know that that's the blessing of living in rural America.
And that's what our poll found. 92% of those surveyed said they had people nearby they could rely on in times of need. Patty Neiman, NPR News.
Now, ladies and gentlemen, I am very familiar with rural America. Just to give you some insight, both of my parents, my mother and my father, came from rural areas. My mother came from a rural town called Fitzgerald, Georgia. And my father came from a rural town called Ocilla, Georgia. So I'm used to being in rural America. I have been in rural America my whole life, off and on, visiting my grandparents. That's where they're from. They weren't from the city. They weren't from a suburban area. Those towns are really considered depressed. They don't have a lot of money. They didn't start even getting big businesses down there until recent years. Those towns literally had no big major store chains, nothing. The Walmart down there have really not been there that long. So I'm very familiar with rural America. I have been driving through rural communities a lot, and that's because my family came from rural communities. And some of them, I tell you what, I've said this before and I'll say it again. Some of those shacks in those rural communities, and yes, I'm calling them shacks. They're not houses, they are literally shacks up in those rural areas. I tell you what, give me a row home in the hood any day. And I really truly mean that, y'all. I have relatives that had trailers in those rural areas. I've had relatives that had houses. Both my grandparents, they had houses. But I'm telling you, you couldn't pay me to live in some of these rural communities. You couldn't pay me. And driving 30, 40 miles just to buy groceries, I don't see that as a good thing. Now, I know some of the people that live there, they're fine with that. They don't care if they got to drive 50 miles one way to get groceries and 50 miles to go back home. I couldn't do that. I think there's certain things I need to be more accessible, you know, and driving 100 miles to get to a 3-hour drive to get to a hospital, that is deadly for somebody that's elderly that might be having a stroke or heart attack. 3 hours to get to the nearest hospital? No, that might sound good many years ago, but in today's standards, that shit sounds awful. That's deadly. But please tell me what you think, ladies and gentlemen. I even, back in the day, I had some friends, even here in New Jersey, that lived in rural communities. You know, they're not my friends anymore, but they were many years ago. So believe me, I am very familiar with those communities, very familiar. But please tell me what you think, ladies and gentlemen. They are struggling bad, and in some cases, they're struggling worse than people in the urban community, as you can see. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.